The lower arm is comprised of the ulna, radius and hand. The ulna and radius articulate with the humerus to form the elbow joint and articulate with the hand to form the wrist joint. The ulna is located on the medial aspect of the lower arm. At the proximal end of the ulna, we can see the olecranon and the coronoid process. Between these two landmarks, we have the trochlea or semilunar notch. The trochlea notch articulates with the trochlea on the humerus, and the olecranon slides into the olecranon fossa of the humerus. Lateral to the coronoid process, we have the radial notch that articulates with the head of the radius. At the distal end of the ulna, we find the head of the ulna, and projecting posteriorly is the styloid process of the ulna. Moving to the radius, at the proximal end, we have the head of the radius, which articulates with the capitulum of the humerus and the radial notch on the ulna. On the proximal end of the radius, we can also see the radial tuberosity, which also articulates with the ulna. Moving inferiorly to the distal end of the radius, we have the styloid process. The wrist is a complex joint. It is formed by 8 carpal bones grouped into 2 rows with very restricted movement between them. In this unit, we do not require you to know all 8 of the carpals, but the 2 we focus on are the hamate and the scaphoid. The scaphoid bone is located in the proximal row of carpals on the lateral side. It serves as a link between the proximal and distal rows. The scaphoid is important as in wrist fractures, this bone is often damaged. It's important to note its location because if it is damaged, it can become necrotic as it has only one blood supply. In the distal row, we have the hamate. The hamate articulates with the 5th metacarpal and has a hook-like projection on its anterior surface. The hand contains 5 metacarpal bones. The first is the shortest and most mobile. Note the curvature of the metacarpals. They are concave on the anterior surface. The hand contains 14 phalanges. Each digit contains 3 phalanges, a proximal, middle and distal, except for the thumb, which only has 2 phalanges. There are 3 ligaments in the elbow joint: the annular, the radial collateral ligament, and the ulnar collateral ligament. The annular ligament wraps around the head of the radius with its anchor points on the ulna. This allows for the rotation of the radial head. The radial or lateral collateral ligament is a triangular shaped ligament originating from the humerus on the lateral epicondyle and merges with the annular ligament. The ulnar or medial collateral ligament is a large ligament extending from the humerus to the ulna on the medial aspect.